Hi, I'm Suzanne Fasella and welcome to the brand new easy way to do healthcare. I'm a physician assistant and along with thousands of doctors, we caregive every day. Our success comes from a formula that has been in place for over 100 years and it is taught in all medical schools across the country. Millions of patients and their caregivers have benefited from this formula. And now it's your turn. Are you frustrated with the time and the effort you have to have in order to get good and timely medical care for yourself or for your loved one? Feeling guilty, sad, scared, angry? Where do I go? What do I do? I hate going to the doctor. It's always the same thing. It's such a chore. Are you always putting out fires when the unexpected arises? Thinking, oh, this will never happen to me, and then the next thing you know, you're in the emergency room because you couldn't get in to see your doctor. Then this free workshop is for you. No longer do you need to feel pulled in so many directions. Angry, frustrated, scared, tired, worn out, or burned out. Knowledge is on the way. And I'm going to show you a formula that works for millions, and it's long overdue. My patients today have an average age of 86, so I am always attuned to how I can help these patients get the most out of their office visit without insurance denying their treatment plans. And it's time you learned what this system is and how you too can know what so many doctors have been practicing for years. Today, I'm going to share with you 2 approaches to medical care. Getting your doctor to do exactly what you want while you get exactly what you need. And making a life you love for yourself. What if you could stay at work and just text your doctor? Or call your doctor in between meetings? Or get an appointment by the end of the day? Or you could choose to manage a healthcare system as problems arise, dealing with these issues one at a time. And history has shown us that both work. You see, one of them works particularly well. I'm going to draw a parallel for how this works for doctors, physician assistants, nurse practitioners, nurses, and their patients, as well as for you. But first, let's start with the why. Why am I doing this? Because we are all caregivers. We all need medical care when we need it. We all want to age gracefully, keep our energy up, know we have the best of the best. I have spent thousands of hours teaching patients and their loved ones how to take care of themselves and one another. And as I pass this on to you, it will change your life. How do I know? Because I see it every day in my practice. I see physicians getting excited when their patients know this formula. And it's a formula that not only works, but aligns you and your doctor, nurses, and staff. You ask, well, will this work for me? Suzanne, you don't know me. Or my dad's impossible. Or my mom is so stubborn. And my doctor makes me wait 3 weeks before I can get in. The thing is, this formula works for people of all backgrounds and all problems. Your doctor's patient load is 2,000 to 3,000 patients and sees about 10,000 visits a year. They will see patients of all backgrounds, problems, and concerns. So this formula is built like pieces to a puzzle. After all the pieces are in place, a picture of who you are in your health starts to emerge. You have your own life and your own picture, and it's different from any other patient your doctor has. The formula still works because it puts in the right piece of your puzzle at the right time. At one time, I was just like you. I was a patient who didn't know any better. You see, I didn't enter the medical profession until 53. I quit teaching high school at age 50 and started PA school. So as I was trying to raise my kids and take care of my mom, I never knew that all doctors had the exact same formula in place for all their patients. I never knew how doctors think and what kind of information they needed from me in order to get the correct diagnosis. I was just like you, sitting out there in a crowded waiting room, getting 5-minute visits and a lot of uncertainty as to what my future would bring. And I was exhausted. I wanted to keep all the plates spinning: my family, my mom, my job, my finances, my health, my social life, and my mental health intact. And I know for many of you, this sounds familiar. Living a life where you are in control, where you have a roadmap, a formula, brings you peace of mind, clarity, confidence, and energy. So what's the secret? We providers use it every day, and I'm excited to share it with you. You see, I believe that we humans are very much alike, and that once we have clarity on what's required, we gain the confidence necessary to excel and be brilliant at anything we do. I've seen it with students. Clarity brings this confidence. How do we get this confidence? Can we buy it somewhere? Can I give you a medication to help you become more bold or outgoing and confident and cooperative as you or your loved ones age? I wish it was that simple. You see, confidence comes through understanding, through education. Think of any skill that you've learned in the past. Let's look at the talk show host, Dr. Oz. Every time he steps out to his audience, he knows he is capable. His confidence comes from his past experience. His experience which has brought a clarity of understanding when and what to do and how to do it. This clarity becomes innate. There is no way that Dr. Oz thinks about the right thing to do while he is in front of a camera. There is no time for that. He never knows what his guests might say, and he has to go with the flow but keep the direction in the show. His success comes from the correct decision which has been learned through the reinforcement that success brought him. Any doubt, any fear, any indecision has long been replaced with confidence. Clarity has created that confidence. So why am I telling you about Dr. Oz? Because when you are in front of your doctor, you have to think fast. You have to get the doctor to listen. You have to have the right questions. You have to understand what's happening before you are in the parking lot and wondering what just happened. That is why your roadmap, this formula, is so important. When I first graduated from PA school and had my first patient, I spent 2 hours with her, going over everything so I wouldn't miss anything or I would do no harm. Other providers say the same thing, but now, years later, we move a lot faster. The same is with your profession once you get experience. So our confidence in this system, as well as our skill and our toolkit and our roadmaps, just reinforce what we have built over the years and make us more confident and clear on what we're doing. Why has the same thing not been happening with our healthcare system? We pay month after month for high premiums, and then when we need good medical care, our insurance pays some of it, but not all. Did I pay some, but not all of my premium? Of course not. Did my doctor order a test and the insurance company denied paying for it? But my doctor felt I needed it. Insurance decided I didn't. When we educate ourselves to make good choices, the correct choice is made in the future over and over and over again. Clarity has created that kind of confidence. But what has created that clarity? Really, it comes back to basic behavior. And there are two paths that you can go down when putting your hectic life back together again. There is a fork in the road. Each of us, either knowingly or unconsciously, takes one or the other path of these two paths. With one path, you're going to be managing your healthcare system. But by taking the other path, we're trained, educated, inspired, and encouraged to ask for the medical care and the health care that you deserve. Today, I want to examine the difference between managing and training actions. And let's look at what's ahead of us when we choose one path over the other. Managing outcomes means you're committed to putting out fires, reacting instead of proacting when health care emerges. Your doctor has a bill. You get the bill. Why is it so hard? Your doctor ordered labs. How to get the labs? Your doctor isn't calling you back. You're trying to get a hold of your labs. Now the doctor says you have to come in. You have to be seen in order to get the results. Why? Is there something really wrong with me? Now I'm worried. You act surprised that this frustration is coming at you, but in truth, this is what healthcare has created. In other words, you never get out from under the shoe is ready to drop. When you manage your healthcare, it means a constant watch out as you keep calling your doctor's office or insurance company or medical records, putting out the next fire. Basically, you are on guard 24 hours a day with a ribbon of distrust now lying between you and your doctor and your insurance company. It means you accept their behavior, and it makes you feel angry or exhausted at having to seek medical care. But if you take this opposite fork in the road, you inspire outcomes. You choose to shape and inspire these outcomes. And this is what physicians and nurse practitioners and PAs have done. It's called the medical model. And I'm going to change your life with this model. How to make confident decisions as you and your loved ones age. To look for things that give you more confidence in yourself. This type of formula looks to empower you as a patient and put you in place to ask more information as situations arise. It means seeing you taking care in a role where you can partner with your doctor, finding solutions with your insurance company. By putting this formula in place, you're going to build your health system on rocks and not quicksand. A team leader who is shaping her employees doesn't manage her people but empowers them. And every good physician works like this too. He or she wants a relationship with you that empowers you, their patient. They want you to have the health you dream of, living a life you love with the people you care about. And when you look to shape or inspire outcomes, it sets the culture, the confidence to ask the right questions in a 5-minute visit. Think quickly and get the care you need. All of this is just behavior. It works the same with our children, our pets, and for us, our patients. When you look to inspire outcomes, you are helping to shape some pretty thoughtful and right outcomes. And this formula created the confidence. So let's talk about the formula. There are 7 steps to every office visit. But before we do this, you want to understand that everything in medical care and health care launches from the office visit. The doctor needs to see you, talk to you, examine you, discuss with you the diagnosis, and then have a conversation with you about the treatment options. This is the office visit. While it is usually done in person, it is now being done over video. But this office visit begins to design and draw out the roadmap that you'll travel as you return to good health. The good news is that every office depends on this roadmap. And every office depends on these charts. And these charts are what's going to launch you into better health. But the bad news is these charts are often wrong. Patients tell me all the time they get their health care and their information online. That is not true. What the doctor sees and what you see online are sometimes totally different. So let's look quickly at what the chart and then at the office visit and how the chart and the office visit together paves your way. But let's start with the chart. Every chart is made up of certain information. And every chart has the same set of information. It contains your office visit, your weights, your respirations, your vaccinations, your medication, old, new, and over the counter, your family history, who died of what, your social history, do you smoke, do you drink, do you have a social life, your labs, are they normal, are they abnormal, your surgeries, when you had them, why you had them, hospitalizations, why are you there, emergency rooms, who brought you in for what, eye checkups, ear, hearing aids, dental work, your medical supplies, your special issues like cancer or pregnancies, auto accidents, workers' comp, your insurance, all of these things, how you want to live, how you want to die, what's your billing codes. And in 14 years, I have never seen a complete or accurate chart. Some of my 86-year-old patients, their charts say they're pregnant or they're breastfeeding. Their medications are wrong or never complete. Whether you go to a doctor's office or a dentist or a surgeon or a dermatologist or you're having a colonoscopy, every doctor has to have this chart with all this information in it. And you'll see why this chart plays such an important part of your doctor's visit. But let's get back to the office visit. What is this? The 7 steps that must be completed so your insurance company will pay your doctor. The 7 steps. First of all, checking in, getting called back by the nurse or the CMA. And then steps 3, 4, 5, and 6, your doctors do this. And then getting checked out. So let's talk about step 1. When you check in, the receptionist will ask you if everything is correct or has anything changed since your last visit. Never, never, never say yes. You do not know what you're saying yes to. If you are new to the practice, they'll just take your information. But it's your address, your insurance, your spouse, your emergency contacts, your medications, your employer. Who knows what it is? I went into an office once and the receptionist asked me if everything was correct. And when I said I didn't know what she was referring to because I couldn't see what she was looking at in my chart, and could she be more specific, she printed out something. And before I knew it, she slams this paper on the counter and said, read it or sign it or change it if anything needs to be changed. While I don't think her action was necessary, I do understand where she was coming from. The folks in the front have to answer phones. They get coughed on, they get bled on, they get sneezed on. They have to wait while you pull out your insurance cards out of your wallets, if you can even find them. They pass out papers, they dismiss patients, they have to set up future appointments. The pharmacies are calling them, the medical records department wants things faxed over, and patients are waiting. And on top of that, they're in charge of the flow of the office. If they don't get the work done at the front, the doctors and nurses are waiting out back. They are the hardest working people in the office and probably the lowest paid. So once you get all this done, the nurse is going to call you back. Now, there's something I need to tell you about this. Please appreciate all that the front office does for you. Make sure you let them know how much you appreciate them. Now, here's a tip. Once you sit down in the waiting room, I want you to look around and see who's sitting there and who comes in behind you. Because I cannot tell you the number of times that patients have sat in the waiting rooms and been skipped over and never said anything. Always watch who comes in behind you. And if they go ahead of you, get up and ask at the counter if you were forgotten. Perhaps this person is sicker than you. Perhaps they're there to see another doctor that's in the office, or maybe they only have a nurse's visit. But at least you checked. Step number 2, you're going to get called back by the nurse or a CNA or CMA. There's so much to cover here that it will take several videos to do it, which is all part of this binder I've put together for you. But suffice to say that they're going to weigh you, take your temperature, your pulse, your blood pressure. Why? Because these are vital signs. These are vital for sustaining life. If any of them is critically high or critically low, we have a problem. And besides that, doctors want to monitor these to see how they're changing and affecting your life or future diseases. We also have to have these vital signs if we want to get paid, because the insurance companies tell us we have to do so. Here are 6 big tips for you. Number 1, don't tell us our scale is wrong. We are only comparing your last weight to your current weight while you're there. If you've gained a massive amount of weight or lost it, we need to know that. Whether you are overweight or underweight, most doctors can look at you and tell anyway. Tip number 2, always get the name of the person who rooms you. I have often had to go find this person and I have no clue who in this office roomed you. Sometimes I have 15 nurses I have to go through to find the one that roomed you. Tip number 3, ask the nurse if she or he can remove or add medications to your chart. I've worked in places where they can and where they can't. So when I prescribe something, your chart says you're already on that medication or that it's going to react, and you tell me, I told the nurse I didn't have that medication anymore. So it causes confusion. Tip number 4. When the nurse tells you that the doctor will be right in, that doesn't mean we'll be right in. Ask if you can sit in a chair. I've had so many patients apologize to me for sitting in the chair, but I want you to sit in the chair. Number 1, I want you to get comfortable. And number 2, when I ask you to get up on the table, I'm looking to see how you ambulate. How do you get up out of the chair? Do you use your arms or your legs? Especially if you're ill or off balance. I am watching you big time, and so is your doctor. Tip number 5. If the room is going to be cold, make sure you come in layered with clothes. Bring a book to read and bring water. Some doctors want you completely undressed and in a gown, so be ready. Others of them want you in their office so they can talk to you first before they take you to the exam room. And tip number 6, when your nurses or CMAs are taking your vital signs and they have to touch you, are you okay with them not washing their hands first, putting on gloves, or using hand sanitizer? It's totally up to you what you want them to do, but you certainly have the right to speak up. It is part of all our training to prevent the spreading of germs. So let's review. What have you learned so far? Now you know what the person sitting at the front desk has to go through. There's a little more appreciation. And you also learned what information they need from you. You will never get overlooked in the waiting room again because you're going to look to see who comes in behind you. And you understand why we have to weigh you and why the nurse or CMA or CNA have to ask you 1,000 questions. And just because you're roomed, that doesn't mean the doctor's going to come right in. It can be up to an hour. How powerful is all this? In the next video, I'm going to show you what the doctor is going to ask you in steps 3, 4, 5, and 6. So you'll be ready to sail through your office visit with understanding and confidence. And remember, the best doctors look at a life of joy and happiness for not only themselves, for their patients. Well, go ahead and send me your comments. And remember, I'm at Suzanne@patientbest.com. I love reading your comments and your ideas. I hate to see your frustrations, but you know what? We can solve those too.